Hello and welcome to 7:30, coming to you tonight from my house. I'm in self-isolation because I woke up this morning with minor cold symptoms, so I went and had a COVID test. I'm feeling fine, and fortunately I can do my job from home. I'll be here until the results are back. Plenty of people in Victoria are isolated at home too, and hundreds of new COVID cases there every day are making it harder for contact tracers to track down everyone those people may have infected. 7:30 has spoken to COVID patients in a Melbourne hotspot who've not even been contacted at all by relevant Victorian authorities to check who their close contacts are. Experts are warning the delay in notifying potential coronavirus carriers is potentially catastrophic. This report from Nadia Daly and producer Alex McDonald.
So just put my mask on. Getting tested for the second time. 14 days are up, so 15th day in.
Charlie Di Lorenzo has been sick at home with COVID for weeks. As of today, his 14-day isolation period is up.
Tested positive a couple of weeks ago, so I've been in isolation. I'm getting retested, even though they said no need. But for my own peace of mind and my family peace of mind, so I'm heading up to the respiratory clinic, and hopefully it comes back all good. Things I've done for the kids.
Charlie lives with his two children, his elderly mother and father in the western Melbourne suburb of Brooklyn. It's a COVID hotspot with nearby infection clusters at JBS and Cedar Meats.
So Mum got sick, so she got tested and came back positive. So Mum got hospitalised a day after she got her test result back. So she was in hospital for just over a week and a half. We all got tested on the 20th of last month. And myself, my dad and my two kids. And that came back positive day after Dad got admitted into hospital as well. So he was in there for just over 4 or 5 days. It's been pretty hard. My symptoms, shortness of breath, runny nose. But yeah, so pretty much been isolated at home, family members helping out, which has been magnificent. He's stocked up with food, thanks to all the family members.
The family say they provided all their details to the Victorian Health Department. But in the midst of a public health disaster, Charlie is surprised that no one has contacted him nor his son to trace where they might have contracted the virus or others they may have infected.
What disappoints me is my dad and my daughter were getting contacted by the health department. Sad thing is, till today, I haven't received a phone call, SMS, knock on the door about myself or my son.
In a statement, the Victorian Department of Health and Human Services said there were now more than 2,000 contact tracers, including medical students, paramedics and ADF personnel.
The contact tracing is relatively straightforward if you have a low number of cases. However, at the moment, because we're reporting 400 to 600 cases a day in Victoria, the number of contacts starts to accumulate very quickly. Given the number of cases under investigation in Victoria, around about 32,000 phone calls have to be made to trace those contacts.
I think the system is broken. I think the DHHS are doing the best they can with the tools that they have.
The first swab goes to the back of your throat, and then the same swab goes up each nostril.
The demand is huge, and obviously it's got more and more intense. Sadly, the ability to respond to every positive case and give some guidance has been stretched.
I'll walk you through that.
Dr Mukesh Haikawal runs a respiratory clinic in the Melbourne COVID hotspot suburb of Altona North. He says he's often been the sole point of contact for his patients who test positive.
When they ring the patient directly, sometimes 2 weeks, sometimes 3 weeks after their positive test, some of them have not actually even been contacted once. And some people in the same family with multiple family members have got 0 answers.
I'm just a private driver, but with all this, can't really work at the moment, so I'm back on their dole.
Daughter, literally laying in bed all day long.
Back in the West Melbourne suburb of Brooklyn, Joe Galliano has been isolating at home for 2 weeks after testing positive to the virus.
Got to stay in isolation, do nothing at all.
Dad went into hospital around the 17th, and ended up with a chest infection and all that stuff. He ended up doing a COVID test. And yeah, like basically we got told on Sunday night, and so we all got tested Monday.
Joe shares his house with his 2 children and his grandparents. They've all contracted COVID. He says it took 6 days to be notified of his results, and he says the Victorian Health Department took too long to alert his son's school.
It's a school, everybody's close to each other, and it's going to freaking spread like freaking pouring petrol on a freaking fire.
The Victorian Health Department said it contacted the school the day after Joe's son tested positive and determined the child had not been at school while infectious. Joe's frustrations are not unique.
There is unfortunately a delay, not just in the person who's actually got the disease being contacted, but their nearest and dearest direct next of kin who actually need to be tested. In reality, we should not be testing them without a DHHS letter. I'm testing them regardless because I know they should be tested. I'm not prepared to wait 10 days, 14 days when it's too late. I'm going to test them tomorrow.
If you're going to reduce transmission from a given case, you needed to turn around the test results within 24 hours and trace most of the contacts within 24 hours. Then you can reduce transmission by 80%. But if there is a delay, say in tracing to 3 days, that goes down to only about 10%.
Victorian health authorities say they're working around the clock to identify close contacts and investigate every possible case.
If we don't get this pandemic under control in our state and our country in the next few weeks with the latest lockdown, it's going to be even worse. We've got to get it right now when we're maxing at 720 plus, but if we get up to 7,000, we'll be in deep trouble.